Hey, what's going on everybody? My name is Dr. Jordan Fairley with Kairos Training Culture and the Source Chiropractic franchise. I have with me the ChiroLux Spark, which is this awesome drop piece made by ChiroLux, and I'm going to show you the two most common ways that I tend to use it. One for extremities with adjusting the knees, and one, surprisingly, with how I adjust the lumbar area. So the very first thing I love about this is you can set the tension, it pops up, and it lifts throughout the entire structure, so not just lifting on one side, so you can put weight distribution on any part that you want. But one of the most common ways I tend to use it is with the knee. So many times I have people with knee pain who don't have proper rotation of the tibia under the femur. So one of the most common ways that will present is with pain along this medial border of that tibial plateau, or tensioning going through the superior lateral aspect of the kneecap and all the way up into the quad. So I usually will test this with a slight knee bend, putting my fingers on that tibial tuberosity and finding how does the rotation of the tibia function. And then I'll also test that with dorsiflexion of the foot. So putting a pincer grasp on the tibial plateau, if I dorsiflex the foot, does this stay nice and neutral, or do they have some type of dysfunction where the knee is rotating out? So if I notice that the knee is rotating out, they have limited movement, and they don't have the ability to rotate inward properly, I love to use the ChiroLux Spark for getting the proper movement back in there. So I can prop it up and then put internal rotation, or whichever direction I need to go into. I'll dorsiflex the foot to get that movement pattern in, and then also right along that joint line, now starting to adjust through. So like that. I'll keep them in that position, prop it up again, and continue to get some movement within the tibia as I guide it into internal rotation and down along that joint line. So it used to be with other types of versions like this that you had to line it up perfectly, but because it opens up throughout the entire width of the piece, then it's really easy to use. So that's an awesome way I like to do that. And then if I notice that somebody has super tight quads, hyper engaged musculature that's pulling up on the kneecap, then I can contact the patella and go superior to inferior, guiding the kneecap down to get a discharge on the muscles and fascia that are pulling the kneecap up. So you get internal rotation here, dropping that patella down to discharge the muscles of the quads, and so many people find relief with it in their knee and better function of the ankle, knee, hip complex as I use this drop piece. Now, Savannah, I'm gonna have you sit up. I also love using this for an anterior dorsal of the lumbar spine. Can I have you scoot forwards a little bit more? And so typically I'll use this on somebody who has a hypolordosis in the low back with a lot of compression, most commonly in that closer to like TL junction. And so if I have her cross the arms, then I can test this by getting extension. So have you stick your belly forward and seeing how does that move. Can then round out, go into the next vertebra, forward. Okay, round out, forward. So I'm feeling closer to like L1 right there, is not going back into extension. So I'm gonna contact that area, but get some more extension into her lumbars to improve the lordosis of that area so that we can take a lot of that tension and stress off that area. So what I'm gonna do is line up the ChiroLux Spark here, because I'm gonna fulcrum this down onto that spot. I'm gonna contact L1 by going right below it, and then have you go down into flexion to open up those facet joints and the spinous processes. I'm gonna stabilize right behind her head so she can put all the weight into me while feeling safe and stable. And I'm gonna take a big breath in. I'm gonna come all the way down, fulcruming onto that spark, and then allowing her shoulder blades and heads to come back. Right there, nice. Awesome, cool. So just that segment move, and she got a great extension in that spot. I'll go here again, I like to check it always, and go into extension. Hey, nice. So now she's getting some great extension into that TL junction there. So what you notice I did is I put her into more flexion, I contacted that spot, and then as I brought her down, it fulcrumed right over my hand. We got extension in that spot, and then I adjusted. Just to show you that adjustment again, because it's really tricky what I was doing with my body right there. Coming down here, fulcrum, extension, and then I like to bring this leg up to get my center of mass over her and to keep my spine nice and neutral. And then I would adjust this way. So if I were to show you that, I'm here and that way. And so it's a whole drop, and you can see the single leg balance. And so those are two of the things that we train within Kairos training culture, and that's why I love bringing the ChiroLux Spark everywhere. So I use it for knees, I use it for other extremities, and I like to use it for anterior dorsals of the lumbar spine as well. So get yourself one of these. If you want to train with Kairos training culture, reach out to us as well. And the Source Chiropractic franchise is going to make sure that we have one of these at every single office. Peace.